So it seems every other patient has thyroid issues these days because every cell in the body has receptor sites for thyroid hormones. These hormones play an important role in our overall health. They play a central role in our metabolism and can be sensitive to even minor imbalances. Disorders involving the thyroid are very common in the United States, and as a result, thyroid hormones have been in the top 50 most prescribed medications for a decade. Truth is that as we get older, we are more prone to nodules and disorders of the thyroid. Thyroid issues are often missed in the early stages, and it isn't until the loss of function and quality of life that they are diagnosed. It's important to note that the thyroid gland is the most common site for autoimmune attack, and thyroid dysfunction is often the first sign in autoimmune condition. Hashimoto's is considered one of the most prevalent autoimmune disorders in the United States. And what's astounding is that over 90% of hypothyroidism is due to autoimmunity. Hypothyroidism can affect gut function and metabolic function, leading to energy loss, mental function decline, and mood swings. Even when thyroid disorders are diagnosed, the treatment available is limited to thyroid hormone replacement, and nothing is done for the patient's underlying autoimmunity. In fact, it gets missed all the time. Over time, if left untreated, which is the case most of the time, the autoimmunity can attack other tissues in the body, which can lead to other autoimmune conditions, increasing the chances of infections and digestive issues. So what are the 7 key things you must know about the thyroid? Number 1 is that thyroid levels are super important for your well-being, so get that checked. The right amount is different for each one of us. When off balance, you might experience fatigue, dry skin, hair loss, brain fog, depression, anxiety, joint and muscle aches, swelling, and cold intolerance. If you have an overactive thyroid, though, on the flip side, you might experience rapid heartbeat, anxiety, insomnia, increased appetite, digestive discomfort like diarrhea, and weight loss. If you suspect you have thyroid issues, go and get it checked. It's an easy check for your primary physician. Second is that women are much more likely to develop thyroid issues, especially after childbirth. So if you feel unusually depressed postpartum, it's a good idea to get tested. Third is high cholesterol can be due to hypothyroidism. Hypothyroidism can lead to high cholesterol because of the metabolic insufficiency and not being able to burn fat. And before considering cholesterol-lowering meds, get your thyroid levels checked first to address that underlying issue. Fourth is most doctors don't diagnose thyroid problems until it's too late. Thyroid problems may affect as many as 10% of women. However, due to improper testing, women are often told there's nothing wrong and are offered antidepressants instead. When in doubt, ask your doctor to check the following. It's the TSH, free T3, free T4, thyroid peroxidase antibodies, and thyroglobulin antibodies. Because if you are hypothyroid, then you want to check to make sure that the autoimmunity is checked, and these 2 antibodies allow for that to be checked. Lastly is reverse T3. Fifth is thyroid dysfunction can cause you to gain weight and make it harder to lose weight. If you've forever been on a diet for as long as you can remember and have a hard time losing weight, it may be time for you to check your thyroid levels. 6 is to eat to enhance thyroid function. It's a good idea to assess your diet and supplements to make sure you're getting your daily doses of iodine, selenium, and zinc, which are 3 key nutrients for optimal thyroid function. 7 is to go gluten-free. As I mentioned, over 90% of hypothyroidism is due to autoimmunity. Even if your antibodies are normal, it isn't uncommon to have antibodies show up the next time you check. Going gluten-free allows you to minimize the risks of perpetuating the inflammation and potential autoimmune condition. Want to work with us? We offer functional lab testing and holistic treatments to getting your hormones back into balance. Click below to learn more all about hormonal imbalances. Thank you so much for watching. Please subscribe to our newsletter on alkalinewellness.com and watch or find our YouTube channel at Dr. Connie Jian. Also like us on Facebook and follow us on Instagram and Pinterest at Alkaline Wellness. Talk to you guys soon.